Hello and welcome to Lok Talks. This is Dr. Lokesh Bhatia. Today's talk will be on a topic, on a complaint which most of you must have experienced sometime in your lifetime, and that is on headache. Dr. Harsha Bhatia, consultant neurologist, will be talking on this particular talk. Welcome, Dr. Harsha.
Headache is one of the commonest pain conditions in the world. There are more than 150 types of headaches, but primarily we divide headaches into two types, primary headaches and secondary headaches. What is primary headache means? When there is no underlying medical condition found for the cause of the headache, that is primary headache, like tension headaches, migraine headaches, cluster headaches. Secondary headache means when there is an underlying medical condition causing the headache, like you have hypertension, brain tumor causing headache, or an intracerebral bleed causing headache, or an head injury resulting in headaches. Migraine is a type of a primary headache which is characterized by a pain which happens on one half of the head, which is we call it as unilateral headache, which is character is throbbing in character, or pounding in character, or pulsating in character, associated with nausea and vomiting, and there is light sensitivity, sound sensitivity, and may be associated with an aura. Aura happens in 20 to 25 to 35% of the cases. What is an aura? Aura is a premonitory thing, or we call it as a warning danger thing which happens before a migraine. It can be of 2-3 types: visual aura, motor aura, sensory aura, or an aphasic or dysphasic aura. What does a visual aura means? Visual aura means before starting of the headache, we see colored lights or a zigzag lights or a black spots in front of the eye, which can last from 15 minutes to 1 hour, and then followed by a headache. There are few cases in which you can just have an aura not followed by a headache. What does motor aura means? Motor aura means that you have weakness on one half of the body. Sensory means you have numbness or tingling sensation on one half of the body. Or the dysphasic aura means that you have difficulty in speaking, slurred speech, or you are not able to speak at all. When you get a migraine attack, just try to go and sit in a quiet room, stay calm and relaxed, drink a lot of water. If the pain is severe, take help of the OTCs. And if nausea and vomiting is there, you can take help of the antiemetic drugs. If the pain is very severe and it is lasting for more than 72 hours, please contact your doctor.
Namaskar. Welcome to Lok Talks. Thank you very much for subscribing to this channel for professional medical guidance, spirituality and meditation, and life coaching. Here is my WhatsApp number. Do connect me in person if you have any question. Thank you.
Treatment and prophylactic treatment. A water treatment includes giving painkiller medications to cut down the pain. The painkiller medications should be taken as early as possible at the start of the pain. If you take at the peak of the pain, the medications are not going to act very fast and the suffering will be more. Besides these painkillers, we have another set of acute management treatment drugs called, they are primarily vasoconstrictor, that is, they constrict the blood vessels. They are called triptans. The category example like sumatriptan and zolmitriptan. The prophylactic treatment or preventive treatment is indicated when you have more than 4 attacks in a month, or there are more than 8 headache days in a month, or the attacks are very disabling so that your functionality is reducing. Then we suggest prophylactic treatment. Prophylactic treatment decreases the frequency and the duration of the attack. There are a lot of drugs for the prophylactic treatment of migraines. Besides drugs, there are now injectables in the market, like you have to take just once in a month, or you can take quarterly injections also. Besides this, FDA has now approved few non-invasive devices for the control of migraine. One is called Gamma Core, the other one which stimulates the vagus nerve, the other one is called Cephali, which stimulates the supraorbital nerve. There are certain red flags which every one of us should know. The first is, if you have a worst ever headache of your life, please do not ignore it. Just go and consult a doctor immediately. If headache is associated with fever or infection, if headache is associated with seizure, if headache is associated with any focal neurological deficit, which we call it as weakness on one half of the body, or associated with vision loss or balancing issues or ringing in ears, like that, or if his headache is associated with positional change, like from lying down and standing position if you get headache, or if his headache is associated with any exertional cause like coughing, sneezing, or if his headache is occurring after 50 years of age, Please do not ignore all these in consultation with a neurologist.